Meanwhile, Australia will hold a national cabinet meeting today to devise a new COVID-19 vaccination program. The Australian authority has abruptly changed its policy and is recommending people under the age of 50 to take the Pfizer vaccine and not that of AstraZeneca. And this, of course, has come after the European regulators reiterated the possibility of links between AstraZeneca's shot and blood clotting. The move sees Australia as seeking tens of millions of extra doses of Pfizer's vaccine. The Australian Prime Minister Scott Morrison has said that plans to vaccinate the entire 25 million population by the end of October will now be pushed back. He further added that the advisory has been provided for administration of the AstraZeneca vaccine.
The Australian Technical Advisory Group on Immunisation, known as ATAGI, has met to consider the medical evidence regarding unforeseen but yet rare and serious side effects mostly associated with younger people from the AstraZeneca vaccine. ATAGI has reviewed that matter, drawing on the international advice and data, and provided recommendations to government, which the Health Minister and I have this evening accepted. That recommends that an advisory be provided for administration of the AstraZeneca vaccine for persons under the age of 50.
But changing its advice for those deemed most at risk, Australia has recommended the use of the Pfizer vaccine for people younger than the age of 50. Australian officials justified the cut-off age of 50 for giving the vaccine by saying that younger people were less at risk of suffering severe complications from COVID-19. But they also stressed on the fact that older Australians should continue to trust the AstraZeneca shots. He further added that the danger from blood clotting associated with the vaccine was extraordinarily low and that it is a highly effective vaccine. It will continue to give the AstraZeneca vaccine to people aged over 70, but those about the age of 50 who opt for the Pfizer vaccine will have to wait. This, as Australia has ordered for 20 million doses of Pfizer's vaccine. And the decision was taken after the Australian authorities ordered an urgent inquiry into findings from Europe's drug regulator report. Remember that there are so far only one case of blood clotting in a patient who received the AstraZeneca vaccine that's been reported in Australia. Under Australia's vaccine strategy, most Australians were expected to receive the AstraZeneca shot. Australia has been one of the most successful nations to stem the spread of the virus so far, but it has fallen behind the government's own schedule in the inoculation drive. WION is now available in your country. Download the app now and get all the news on the move.